my good friend Joe Scott Jones.
Hi there, Buzz.
Joe, take a seat. Joe, I have heard this expression that Mark Twain said, "Give a man a reputation as an early riser and he can sleep until noon." Now then, he obviously wrote that before you came on, because Joe, I have no idea how you sleep. You're chairperson of GP Network, you're on the faculty executive, you're a GP in Opatiki, I can never pronounce that. You taught me a new disease, multiple diplomatosis. You've got more letters than the alphabet. And it's very good of you to come here today. And now then, we wanted to know more about the Rural Health Alliance and how yesterday went. And especially people listening, they might even say, what Rural Health Alliance? We didn't know there was one. So could you tell us about that? And
absolutely, yep, Buzz, and again, thank you very much for giving me the opportunity. The Rural Health Alliance Aotearoa New Zealand, I suppose, arose out of some of that pressure that you talk about, of there being multiple organisations that are involved in the health and well-being of people living in rural communities. You know, for me, the New Zealand Rural General Practice Network, the faculty of the College of GPs, and for others, you know, Rural Women, Dairy New Zealand, Federated Farmers, the New Zealand Institute of Rural Health, various PHOs, and obviously councils, local authorities and so on that have very concerned about the outcomes that they see in their rural communities. So I think the Rural Health Alliance Aotearoa New Zealand, or RANZ, is an organisation whose time has really come. It's what I would call a common ground organisation, bringing together different organisations to seek the common ground where a unified voice moving forward may help to make the work of each individual organisation more effective. So yesterday we had our inaugural meeting. We've launched our organisation.
Congratulations.
Looked at the finances, which are of course are quite difficult, and elected our first board. But probably more importantly, had several presentations about the issues of rural workforce in primary care. Currently, I think there is what can be determined a crisis in rural workforce. From the Rural GP Network figures, we know that 25% of practices that we know of are looking for permanent replacements at the moment, and there's various reasons for that. We heard from Dairy Women New Zealand, who are undertaking a study of health and well-being in rural communities, how rural communities have a higher propensity of obesity and lack of exercise, surprisingly. And of course the issues around cardiovascular disease that might sort of flow on from that. They're also looking, along with Federated Farmers, who gave a presentation, at mental health issues in rural areas, which is a key and I think with our current drought, quite a scary issue really. Each time Federated Farmers, they're collecting amazing data year on year, and are able to say in years where there's been weather crises, there's a spike in the number of men committing suicide in rural areas. And so, you know, heaven knows what's going to happen, you know, with our current drought crisis.
So I suppose it goes two ways. I think on the one hand we've got what can we as GPs get out of the Rural Health Alliance, and I suppose the other side of the coin is how will the Rural Health Alliance in turn help the communities we're looking for. Perhaps we can pick the first one first and we'll come back to the second. So for rural GPs, what are we going to get out of the Rural Health Alliance that hitherto we wouldn't have got?
I think general practice has always been concerned for the outcomes for their populations. We live in those populations. We have friends in those populations. Our kids go to school in those areas, and so you know, the intimacy of general practice with its rural general practice with its community is one of the key features, one of the things that actually attracts people into rural working life in health. And one of the key things that we will get out of RANZ is not only the closer association of the rural community-based organisations, and an increased knowledge for them of the issues that we face, and therefore a greater strength when we take messages forward to government and to DHBs and PHOs. But we'll also have better penetration into those communities. Dairy Women New Zealand are going out into communities and are organising health and wellbeing days. And they're taking people with them to provide those health and wellbeing services. We can provide them with the staff from the local practices that will then enhance the relationship of those local people with their local primary care teams. Yeah, I just see growth after growth after growth, really, in terms of what general practice will get out of it. And I think that leads into the second issue, which is what will those organisations get out of RANZ. Just the communication sharing. I was stunned by the amount of information that federated farmers collect about communities. They can show the impact of losing your rural postal service. They can show the impact of losing your school, on a range of health issues over a period of time, which is such powerful information. And without that sort of information, we find it really difficult to argue our case.
And I presume there's overseas models as well, are there, which we can learn from? The Australians have got their Rural Health Alliance. How do we compare and contrast to them?
We're in our infancy compared to Australia, and so grateful for the support that we've had from the Rural Health Alliance Australia.
They talked to you yesterday as well, I believe.
Leslie Barkley came over from the Rural Health Alliance yesterday and Australia, and talked about some of the challenges, some of the things that they've learned. When we first started talking about this organisation a year ago, we had Jenny May from the Rural Health Alliance Australia, who provided us lots of documentation that we could, I think the word isn't plagiarise, it's leverage from. So that's been really important in us setting up our structures and so on. And one of the key issues for us is about finances and about our relationship with government. This is something in Australia which the government find is incredibly helpful to them in actually doing what they want to do in rural communities. If the Rural Health Alliance really helps them to achieve the goals that they want to achieve for their communities, and we want to show to our government that the same thing can happen here.
I really respect the energy which you and everybody else is putting into it. How can we as rural GPs get on board with this new Rural Health Alliance and make it grow legs and run and mature the way the Australians have?
Read your e-zines that come out from the Rural General Practice Network regularly. Look for the local opportunities that Federated Farmers, Dairy New Zealand and so on may be offering in your community. Be prepared to stand up and take part in those activities. Continue to support the Rural General Practice Network. I think it's an organisation that needs your support, and these sorts of activities wouldn't happen without your membership and without their membership and their support.
First class, mate. We really get behind that. We certainly do, and thanks for everything.